umfundisi has sent.
Who sent the link?
Eh?
Who sent the link?
Umfundisi.
I still have the link from Mohammed here.
Eh.
The new one. I'm sending you the new one now, Chief. Okay. I'm getting everything on the screen. What did you know? SABC is coming to you now, Chief. Okay, I'm waiting.
Are we good?
So we're still using the KZN line? No, we're going KZN Health, Chief.
We're going KZN Health, yeah.
So we're using KZN? Yeah, KZN Department of Health.
Yo, this thing I thought it was very easy.
It's the best we can do for now. I don't think we're going to get any.
Wait, no. We changed. Remember that the camera that we are using is a camera with 100% quality. But we are now using the link of health. So we just swapped the camera. We changed the camera of health and used the other camera that was 100%. Because health was 90%. Am I right?
Yeah, but now Chief, it's dropped a little. The quality has dropped a little.
Kahleni, ebafu. Ngicela nimfundise ke ningilungisele ilokhu zami. Ke ningilungisele ilento. Ngicela ke ningilungisele indaba yamakhamera. Yiphi ikhamera esisebenzisayo? But why are they saying they were saying quality was good earlier on, but the quality now has dropped?
No, you see now it is zoned out a little, but it's looking better.
Look at what's the code? Angithi kulead of government phela uhlala be. Uhlala eMS. Isikhwama sami lesiya. Audio, are you guys good?
Audio will record from there. Yeah.
Are you able to pick us SABC?
No. We can only send one person.
Colleagues, SABC, are you getting sorted now? Angisathola feedback. Mohammed?
Yes, Chief.
What happened to the SABC?
I don't know where SABC, Chief. But I think that all sound is coming through fine as well.
So sound and camera is good on your side, on their side?
Yep.
Because we are just 1 second. Ngomsi. We're about to start the media briefing. We're about to start the media briefing. How? I would say yes. I we command council. And my colleagues I asked, they have been, even yesterday, I've been talking to them in financial input. Hello? Hello? Mohammed? So I said, so just 5 minutes. Yeah. Mohammed, SABC?
I'm good, Chief. I'm good.
Yeah, it looks good. Looks very good. SABC? Data? Yeah, one more hand, but so right man.
Not 100%.
Are you getting the sound though?
Yeah, I'm getting the sound.
The picture is what? Okay. 1 2 1 2 1 2. One, two, one. Mohammed, can you hear me? Mohammed. You see, I've muted myself here.
Yes, I can hear you, Chief.
Yeah, but you're not responding, so you're not helping if you're not responding. Mohammed, no. We're testing the mic direct now. Tata.
The quality now is 100% now.
Okay, sound?
Sounding.
Mohammed.
Yeah, I'm for it. Yes, Buff. Tata.
Mr. Mabaso.
Yes, wait, Mohammed, just 1 second. Tata.
Sure.
I'm trying to talk to you via the mic. I've muted my phone, so I'm calling you via the mic, so we are not responding. So it means we are not getting the sound. Can we start?
We're good to go, Chief.
Okay.
Okay, Mohammed, wait. I hear you. You are sorted. Tata, can you start?
Izindaba nje ufuna shone kuwe. Sazana bopta beka kanje.
Wait, can we start? Are we ready?
Thanks, Mr. Mabaso. MEC Nomagugu Melane Zulu, the HOD for Education, HOD Dr. Nzama, officials who are here from various government departments, ladies and gentlemen, the Multiracial Congress Alliance adopted the Freedom Charter in apartheid. Through their tenacity and unity of purpose, they were able that were so challenging. Will decay in the number of fighting toward a decimate. Even though KwaZulu-Natal continues to maintain a rising but stable curve, we cannot afford to be complacent in other provinces. That things are worse in other provinces. In KwaZulu-Natal so far, 7 days, in KwaZulu It's 3,417 recoveries. This therefore means that in the past week, people having tested to frighten our people who are facing a serious pandemic, it's an invisible us so easy and think that things are now normal. The disease, which include hypertension and diabetes. And diabetes is around 52. In terms of the cases, KwaZulu-Natal have been receiving a variable number of new cases daily. The number of cases reported in the province is 30 cases daily. eThekwini, iLembe and uMgungundlovu have had a number of cases provincially. Approximately all the districts have had an upsurge of cases since the beginning of June 2020. This week, uMgungundlovu district reported more cases than iLembe on a daily basis and now occupy the second spot. Ugu and Herigwala are recording cases from the Eastern Cape due to their close proximity of and we are one country, and therefore we need to work together to deal with this challenge together. iLembe district is now the third highest district in terms of infection rate provincially. The district had a slight decrease in the number of new cases for the past 2 weeks. eThekwini is still the epicenter of COVID-19 in the province. We have noted that eThekwini South sub-district has had the highest curve with 1,493 cases, followed by the northern sub-district with 1,220, whilst the western sub-district sub-district with 646 cases and 57 on daily basis in uMgungundlovu. However, as of June, even these sub-districts started to report new cases on daily basis. In terms of the breakdown, when it comes to cases, in a 189 cases, and in uMgungundlovu we have 877. Uthukela there is 351, King Cetshwayo 260, Ugu 232, Amajuba 184, uMkhanyakude 79, Herigwala 130, Zululand 77, Umzinyathi 73, it is about 110. We have seen recoveries active. It's 4. We are also concerned. A total number of 478 healthcare workers have tested positive for COVID-19 in the province in both public and private healthcare facilities. This includes doctors, nurses, allied healthcare workers and support staff. With regard to infection rate at a provincial government department, the provincial government departments, wonke, have reported about 400 of most of our concern, if we move to the infection of staff, out of concern for growing statistics in this regard, interventions, intensify and regular training, behavioral change, of COVID-19. And doffing procedures, we will also want all the role of so continue. With regard to tracing, contact tracing, we have managed and positivity rate on contact is still at 4.4. A total of 6.4 45,469 units COVID. Since the outbreak of COVID-19 pandemic, we have largely been reporting We are also noting that there is increasing non-compliance as more and more public transport operators are no longer adhering to COVID-19 health requirements. This is causing a in the public fully comply because healthy, the public transport industry will thrive and succeed. It is clear from the emerging around due to people's failure to adhere to the precautionary measure. This positive. Quarantine, they collect them or send their vehicles a few see them going to quarantine. It is unacceptable that people should be forced to go to such length to hide their association with COVID. Parents or for others, understanding that COVID-19 is a disease that can affect anyone, anywhere, and at any time. People who have tested positive for COVID-19 or those who need to get tested need our support and our understanding. They do not deserve any vilification or judgment. Let us support all our people, including those who have been infected. The impact on the economy, as the province that derives significant tourism, we welcome the easing of regulation that have seen further opening up of more economic sectors, especially those linked to the tourism sector. On Friday, the 26th of June, and timeshare facilities now allowed to accommodate business travelers and essential service providers with certified travel permit, while noting the strain that the chain is facing in rebuilding. The Golden Mile, acquisition of these the necessary support to intensify our effort in assisting businesses with their application for a relief fund. Cushion the blow on the and preserve livelihood of our people. We have seen increase in number of confirmed positive cases involving teachers, they operate. As we see number of confirmed positive cases increase every day across the country, we expect to see some increase in reported positive cases in schools. There has been an increase in the number past had 77 were teachers and 13 were learners. This week, the reported number of infected people in schools has increased to 187, of which 139 are teachers and 37 are learners. The Umkungundlovu district lead in terms of the number of infected teachers. What is critical is how we manage the situation in schools where positive cases such that the risk of further spread is minimized. Obviously, no measure can replace stricter adherence to health protocol and regulations. Both the Department of Health and Department of Education have handled the cases extremely well, and we commend them for the work they've done. We are encouraging people to allow the Department of Health to take a lead in the management of COVID-19 cases, even in schools. The Health Department will this or testing will be limited to primary or close contact. Ordinarily, it should take the Department of to decontact in Zululand now also came to our attention that large parties and this could have situated our law enforcement with effect. We want to more space for despair, although indications are that it to double up our effort and for at least those with one of us to cap the infection rate and to move all of us closer to a COVID-free era. As we start the Men's Month, the start of July signifies the start of Men's Month, which places the focus squarely on the role and the behavior of men in society. We will continue with our effort to reduce and ultimately eradicate the scourge of gender-based violence, which has continued to afflict us in the recent weeks. We would want to encourage all men to play a role. We must all say not in our name. We must all be protectors of mothers and girls. We must all teach our boys to behave themselves and to respect women and girls. With that, we wish to thank all of you for being with us today.
Thank you very much, Honorable Prima. Without any further delay, we quickly take the questions, and we already have some that can be asked via the social media platform. Can I get an indication of that of the colleagues here? I see Karinda, Samantha. Okay, we'll start with the two colleagues, then I'll ask Adam.
Get your comments with regards to things. Can we please get your comments with regards to Santaco KZN, which wants to possibly. Oh. Premier, can we please get your comments with regards to Santaco KZN, which wants to operate their vehicles fully tomorrow, despite lockdown regulations, which calls for certain permits? Sorry, it's not working. And then with regards to gender-based violence, Premier, yesterday we did see several protesters at the Durban beachfront. They did not have permits to gather, but they want to know from the KZN government again what programs are implemented going forward. We're not seeing action on the ground from community workers with programs. What is the government doing?
Premier, just mine is related to what my colleague Karinda has asked, but basically, with Santaco threatening to load full capacity from tomorrow, in your statement you have just mentioned that you are concerned about public transport and the spread of COVID-19. Are you worried that should they go ahead with their threat to load, that will make the situation worse? But also, number two, on the issue of schools reopening and other grades coming back, you have just given us some statistics. It's clear that to increase. Are you worried about that possibility that when other grades come back on the 6th of July in KwaZulu-Natal, we are likely to see more cases of COVID-19 for both teachers and pupils? Unfortunately, the leader of government is not here, but since you touched on the issue of the economy, with the hospitality industry reopening as from tomorrow or as of Monday, what are you going to do to ensure compliance? Because during the level 5 of the lockdown, we saw some business entities in KwaZulu-Natal not adhering to the regulations. Is there a case of COVID-19 in your office, Premier? Number two, when it comes to the Department of Health, can you talk to us about Nkosi Albert Luthuli? If you can, how many confirmed COVID-19 in Nkosi Albert Luthuli? Because based on the report from the Mercury, there are more than 30. Thank you very much.
Thank you very much. Karinda, you want to have a second one?
With regards to ventilators that are available for our province ahead of peak infections.
Okay, I think that's kind of with the one in terms of the daily news about the increase in the number of cases at the Nkosi Albert Hospital. Does the MEC have an idea how the numbers managed to increase this much in the hospital?
No, good afternoon, ladies and gentlemen. Thank you very much for the questions. Let me start with the question. I think it's a simpler question on how many ventilators do we have in the province. And I'm sure you are aware that as a department, we have been working very hard on increasing our capacity, both in relation to ICU beds, but also your isolation and quarantine beds. Now, as a province and as government, we have just about 200 ventilators in the province. There are other ventilators that are available in the private sector, and that number also goes to about the same. However, we as the have also ordered new ventilators. We've ordered about 100 ventilators on our own. We have been also promised a donation of another 100 ventilators. I must indicate that this order of the 100 ventilators that I'm speaking to was actually issued around March, and we are still waiting today for the delivery of these ventilators. As a result, we have then also agreed with the head of department that he needs to start engaging the Director General at a national level, because we are participating in a contract that is managed at that particular level. Now, the reason why it's only 100 ventilators that we have ordered now, because we ordered in March, our plan was that we'll order in March, and by end of March they deliver the first 100, then we order the second batch. And the fact that they've not delivered then is beginning to eat into that time and that planning that we initially had. The reason why very quick in chasing them, the challenge of shortages of the equipment that is utilized not just in South Africa but in the world, but it is a challenge to us. So we have decided that we need to escalate the matter. While we agree that the beds that we have, the actual beds that we have would be ICU. I said in private sector, sorry, in the public sector, it's about 200. We've also decided that the new reconfigured beds that we have created in the different facilities, some of them can be converted into ICU beds should the need arise. So we are going to be utilizing those as we move along, as and when there's a need. So I'm just trying to indicate that while the actual beds that we have physically right now are that number, but there is a plan that says where are we, how are we moving forward. What is the issue in relation to Inkosi? I would like us to not just speak about infections in Inkosi or Chief Albert Tutul Hospital only, but the infections generally of the health workers, and as has been spoken by the Premier. The challenge that we are faced with, like we said, is that we are beginning to, as we see the surge, the infection rates of our health workers is also going up. Last week, I think if colleagues would remember, I asked the same question, and I made a commitment that we were going to have engagements we're going to have a discussion amongst ourselves with presentations that we're going to give to the unions, and the unions contributing. I must say that we are very happy those engagements this week, and one of the things that we agreed upon together, ourselves and the unions, is the fact that it looks government to follow, but one of the fact that it looks like our occupational health and safety committee hospitals, and if they are there, committees to be functional, it's because they are the ones who are going to work, giving the PPE properly, looking at whether, including the issues of saying during rooms, do they sit according to the required 2 meters as we have been normally doing? And we believe that is one of the challenges that we've also started, depending if a common room is workers at a time, only to be seated exactly, includes the usage of and with protocols in relation to the infection on Nkosi Albert. investigating the fact that our numbers are increasing, but remember that health. So up and grow as if the health at home don't take care of themselves as they should. Sure that we find the
issued. However, the matter is also a national challenge. National challenge that Minister Mbalula is dealing with. In KwaZulu-Natal, where we are mitigating hand the business. On another hand, said that in this week about 28, and that's must be concerned. So trying to mitigate and find each other will be important. So MEC Nduli is dealing with them, and we will take it from there. We are worried about the cases of campaign last year. You to follow. So the work at that level is engage with them at any time. In that, as meant to ensure that coordinate to play in the fight against and change. And also that hospitality about ours is to ensure that we have with the hospitality close through Durban tourism support them, and while we support them, we expect that they will adhere and cooperate. With regard to cases in government, yes, it's only safety and liaison. So we must understand that we are expecting that schools will be opening, and additional grades will be coming back, announced. We are getting ready with the Department of Education having that there is orientation that take place. Teachers have already been orientated. So that's where we are for now, and we'll continue examining issues as we go forward. Maybe on my side, so that we don't, we allow the space if questions are toward the MEC. Siyafisa ukuthi lwe-Freedom Charter njengoba kwahlangana i-Congress Alliance eyayiholwa yi-ANC kwa-adoptwa i-Freedom Charter eCliptown ngo-1955. Le Freedom Charter yakhambane bakhulume ngazwilinye githi inkinga esibhekene silalela futhi silandela imigomo. Abantu asebethelelekile sebe kodwa 28 baphambili theleleka kwabantu isikakhulukazi attention esikubonile futhi leli sonto ukuthi kwi-district iy'namba ziyezanyuka khona isikakhulukazi eMsunduze naseMngeni kubantu bakhona cases are active abantu abasabambekile bangu 4,250 ukuthi iningi labantu ababanjwa lesifo bayarecover, kodwa kumele sigweme ukuthi umuntu atheleleke. Abasebenzi bezempilo thelelekile ngali abantu abangu 15,000 kanti u99% walabo ne abantu dolobheni kodwa bonke abantu kumele anikwe support umthelelo omkhulu kwezo mama unkosazana Dlamini Zuma uyithe indawo eziningi nezimboni eziningi zizovulwa enze kanjani ona ulele kakhulu kwi-tourism njengoba i-tourism iya nayo uvulwa kuzoba amabhizinisi ukuthi ukuthi noma kunyuka alo siyamanage thisha mase ngamanzi insipho for 20 seconds siqinisekise ukuthi la vikeli
that is coming from the witness wants to know the number some of the hospitals so can the MEC for positive patients at question is coming from the Eyewitness News. It is directed to taxi owners will be loading full capacity in violation of the law. Will drivers be impounded? So there's that question. If we go to another question from the SABC, some of them have been answered. The one that has not been answered is relates to meeting patients in the quarantine are the health workers getting psychological? The others, I think they were answered in terms of the statistics and also the number of health workers affected. Liz comments from the Mercury. She's asking, she was restaurant has a capacity to seat 3 times. So
the taxes, as I've indicated, the tax and the together, and so
of course, we are beginning patients that mean we are going to be put. So we that's why I what we play the admin outside of our hospitals, yes. And we in those areas purely didn't in the epidemic. What regiment is to by more point one can't just at face value respond to. I think if there's a
to incubate for incubation process, especially of ideas that which are there in the townships, because you may find that government has agencies in a form of Itala, CEDA, CIFA, but the financial institutions where you the incubation process to make it a point that maybe in township for these agencies where they idea a workable idea, the person give himself or herself a pat on the shoulder to say, at least I've done something in my life. of activities, the rural areas and the centers to say, especially in rural areas, they work not through the beneficiaries. Is there any plan maybe to monitor their performance so that in the rural areas and maybe in here in the townships?
The economic losses due this
The history in that development and I think there is a program is that program already operating in our townships. So I think it will be the matter of connecting and ensuring we will be also looking on must implement balancing. There is a regulation that people you can accommodate that